What if I told you that pain is not the biggest challenge after knee replacement surgery? While pain is a primary concern, it's just the tip of the arthritis iceberg. Over 30% of people who have had a total knee replacement report dissatisfaction with physical function over 1 year after surgery. And this is despite typical rehab. So to help you have the best possible outcomes, we'll be diving deep into the research behind arthritis and surgically induced knee muscle weakness so you can lessen its effects. And stick around until the end, where we also discuss recovery tips and tricks to strengthen those muscles and maximize your recovery. So whether you have knee arthritis, are considering surgery, or already had a knee replacement, this video is for you. Research has shown that those with knee arthritis exhibit over a 20% strength deficit compared to those without arthritis. And what's even more important to understand is that those who have decided to have a total knee replacement come out even weaker, with people having almost half the amount of strength in the quadriceps muscle than before surgery. But why does this matter? Well, quadricep muscle weakness has been linked to the development and worsening of knee arthritis. This makes sense if you understand one of the key roles of muscles. Less strength results in greater stress through the joints, much like the shocks on a car. But not only that, it can negatively impact success after surgery, despite that brand new knee of yours. About 75% of those who had a knee replacement report persistent issues climbing stairs. And this is not surprising when you were to compare the long-term strength of someone who had a total knee replacement to someone who did not. Those who had surgery have been shown to have upward of 30 to 48% less strength in the operative leg. That's an incredible amount of weakness to be dealing with for the rest of your life, which has been shown to result in slower walking speeds, impaired stair climbing abilities, and a higher risk of falling. But why does this weakness happen? Well, researchers have identified two causes of muscle weakness. The first is the atrophy of the muscle, or the muscle simply getting smaller. Smaller muscles, as you would expect, result in less strength. And there is no muscle that is impacted more than the quadriceps muscle, that muscle right in the front of the thigh. Quadriceps atrophy of 5 to 20% has been reported in the first month after surgery compared to preoperative measures. But what is surprising is that this is not the primary cause of muscle weakness after surgery. The main reason for muscle weakness is something called orthogenic muscle inhibition. It causes almost twice as much failure in voluntary activation of the quadriceps muscle compared to loss of muscle size. Compounding the issue, orthogenic muscle inhibition in those with arthritis or after total knee replacement has also been shown to contribute to muscle size loss. This occurs due to lack of stimulus fully activating the muscle, which is needed to maintain muscle mass, following the use it or lose it concept. And this is important for people considering total knee replacement to understand, because the surgery will not solve muscle weakness issues. And unless specifically addressed with appropriate rehab, it may even worsen after surgery. Now, research shows that quadriceps strength does improve by about 10 to 20% from preoperative levels following total knee replacement surgery. But very rarely do people ever regain strength values close to those who did not have surgery, or the strength levels of the other non-operative knee. This suggests that the current rehab approaches may be inadequate, and a more aggressive and long-term post-operative rehab approach is likely needed for those who receive a knee replacement. But what should this look like? But before we touch on the specifics of rehab, make sure to take a second and like this video if you're getting value. We put a lot of time and effort into researching and developing content so that you don't have to. So help this video spread and help more people like you who have rehab-related questions. And consider subscribing to the channel so you can stay up to date on all your rehab-related needs. Now let's get back to the video. Preoperative rehab is key. As we mentioned, those with arthritis often have significant muscle weakness. Going into surgery weak means you're just going to be coming out even weaker. So building up as much muscle strength as possible prior to surgery is essential to improving post-operative physical performance. Now, this can be tricky if there's significant pain prior to surgery, as there is a limit to how hard you can push someone, which impacts the amount of strength that can be gained. This makes working with a physical therapy professional important to tailoring your exercises to minimize pain so that you can maximize strength gains. However, after surgery is a different story. After the first 6 to 8 weeks post-surgery, when pain is better controlled, the intensity of exercises needs to increase. And that doesn't mean just doing bodyweight squats or step-up exercises forever. While these are good exercises early on, you need to progressively load the muscle to promote actual muscle strength changes. And I believe this is where many go wrong with their recovery, as they are hardly ever exposed to enough load to make true changes in their muscle strength. More progressive, high-intensity exercises are likely necessary to improve muscle size, activation, and address strength deficits, along with functional mobility early on after surgery. Using weight machines such as leg press and knee extension machines are very helpful in ensuring sufficient loading is achieved. Now, how much weight is needed to gain strength? Well, resistance training that exceeds 60 to 70% of someone's 1 repetition maximum has been demonstrated to induce increases in strength. So this means exercising at an intensity of 2 to 3 sets of 10 to 20 repetitions using the heaviest weight you can handle. Exercising at this level will ensure you are loading the muscle enough to help promote gains in strength. Now, progressive loading solves the atrophy problem, helping to build up the size of the muscle to produce more power. But what about the issue with muscle inhibition? Because remember, it's not just about the size of the muscle, it's also the activation issue that comes with arthritis and total knee replacement surgery. Well, there is evidence showing that adding neuromuscular electrical stimulation, otherwise known as NMES, to a physical therapy routine could speed up recovery of quadriceps strength after total knee replacement surgery by combating muscle inhibition. Research suggests that using high-intensity NMES on the quadriceps muscle results in strength gains surpassing those who did not use NMES. And there appears to be a positive dose-response relationship for NMES, with patients who achieved a higher percentage of their knee extension maximum voluntary contraction torque experiencing greater strength gains. That means the higher you crank up the intensity of the machine, the better the outcomes. So turn that thing up. These findings suggest that NMES early after total knee replacement could enhance active strengthening exercises and be a valuable addition to rehab, particularly in the first 6 weeks after surgery. I have provided a link to an NMES device that you could use at home in the description. Check it out if you're interested. I suggest making sure to consult your healthcare provider before using it, who can provide specific recommendations tailored to your needs. Understanding the science behind arthritis-induced knee muscle weakness is critical for anyone dealing with knee arthritis, contemplating surgery, or recovering from knee replacement. It's not just about managing pain, it's about restoring muscle strength and control. With such a high number of people dealing with persistent weakness, slower mobility, and increased risk of falls, it's clear that we needed a better approach. By utilizing preoperative rehab, incorporating progressive, high-intensity exercises, and utilizing neuromuscular electrical stimulation devices, you can combat muscle atrophy and inhibition. Well, if you found this video helpful, be sure to give it a like, subscribe to the channel, and share with others who are facing similar challenges. Together, let's empower each other on the journey to recovery and improved quality of life. And stay tuned for the next episode of Physio Show, so you can learn more about your body, how it works, and what it needs to keep moving.